I'd just like to invite our next speaker, Dr. Nimit Goyal, consultant radiologist, to explain to us the role of radiology in promoting bone health in Wales.
Good afternoon, everyone. Thank you very much to the organizing team for inviting me, especially to Dr. Singh for, first of all, appreciating the role of radiology and bringing us to this platform so that I can share that role with you. And then hopefully we can advance what we do in Aneurin Bevan and also replicate it across all health boards in Wales. Why is this identification important? I know this has been talked about in several talks, but I think this is important. So 12% of ladies above the age group of 50 will have a vertebral fracture. We know that from prevalence studies. And that number goes up to 20% when the ladies are above age group of 80. But 70% of these fractures are actually undiagnosed. And then there was a recent study done looking at GP records within UK, which looked at the identification of these fractures in GP notes. And then when you look at that, it actually goes down to 0.1%. So only 0.1% of these patients are actually known to have a fracture in GP records. So that's a significant discrepancy in what prevalence should be and what we know about. Royal Osteoporosis Society published this paper in 2017. So we know that patients who are known to have vertebral fractures can go on to develop fractures of their hips or more fractures of their other vertebral bodies. We know that the vertebral fractures are underdiagnosed. And but what's even more worrying is that in the ones that were reported, there was no action taken. So the clinical action, both the radiological report missed the finding, plus there was no clinical action to follow up if it was reported. So if we do report these fractures, then comes the second point that currently we call them various things. The radiology department IT finds it extremely difficult to pick up these because there are so many various terms being used. So I think there is a desperate need to actually standardize the terminology we use to report these fractures. Robust and ongoing education program. So the Royal College of Radiologists in their paper have said that there should be an osteoporosis lead for every health board who should then be linked in with the Fracture Liaison Service in that health board. And that radiology osteoporosis lead should also then go on to educate their own colleagues. We have got several platforms within the radiology. We have got several educational meetings happening, and they are ideal places for this radiology osteoporosis lead to educate the colleagues about the importance of reporting these fractures, about the importance of establishing a terminology which is accepted across all Wales.
Thank you, Nimit, for that insightful talk into the role of radiology. No doubt that radiology has a big role to play in an FLS.